Hyperbaric medicine was something that I think historically I was a little anxious about for a number of reasons, and I'm not going to go into those today, but my anxiety level about hyperbaric medicine is totally shifted. I got board certified, as Eric mentioned, and I'm going to talk about the virtues of why hyperbaric would be a really nice add-in to the enhanced protocol, because specifically I'm going to talk about brain health, right? And that's our whole focus. So I want to start with this quote by Ashley Montague that the idea is that we die as young as possible, but as late as possible, right? That's everything that we do in the enhanced protocol. I would be much less interested to add years to my life if the years that I added to my life were in a nursing home or an assisted living center. I want to keep my youthfulness as long as possible. So with that intent, I'm going to talk about how hyperbaric helps us do that. We all know someone who has had terrible wounds, and I apologize for this graphic, but I was trying to find a nice graphic that showed a wound on the head. Because hyperbaric, when you leave this webinar today, I want you to know that hyperbaric is a treatment for wounds. Now, it is a wound of any type. We're most accustomed to hearing, well, you get hyperbaric treatment if you have a diabetic wound, or if you have a gangrenous wound on your foot, or an osteomyelitis that won't heal. But you need to leave recognizing that hyperbaric will help heal any wound in any location that has been there of any duration of time. So let's say that wound is 20 years old. Will hyperbaric make a difference? The answer is yes, it can. Now notice I used the term make a difference. I didn't say completely heal or change or cure. I didn't use any of those terms. It affects wound healing of any location and of any duration by a mechanism that I'm going to spend the time talking about today. Most of you are accustomed to hearing about hyperbaric in terms of what insurance will pay for. So, will your insurance cover hyperbaric treatment for the following approved conditions? And I'm going to spend no time on this slide, right? Because I work in medicine, and I know that half the time medicine says it will pay for things, and then you try to get it prior authorized or pre-approved for treatment, and you get denial after denial after denial. And I've had a lot of people that I have referred to hyperbaric treatment for one of these approved conditions, and I still could not get the approval, right? Because insurance is a pain. Insurance is kind of, if we fight with them long enough, we might get them to pay for something, but oftentimes you don't. So there's only 14 reasons that your insurance would consider even paying for hyperbaric. But my point today is, look, if the science is good, why isn't it generally accepted? And we know that in medicine there exists this fact, right? It's a medical fact. And it's established and believed to be a certain way, and it's virtually impossible to get anyone else to think outside of this box. So if hyperbaric treatment treats wounds, maybe it would treat a wound like a head injury, or maybe dementia is a form of a wound. And if we could apply the same principles to that wound, then it could potentially get better. So I'm going to spend all of my time talking about, air quotes, off-label use of hyperbaric. Off-label would be, it's not approved for this treatment. FDA says you can't make any claims about it. I'm not going to make any claims. I'm going to say, let's apply the principles. So look at this study. This was released, this is new. This is just a couple of years old, in Aging of 2020. Cognitive enhancement of healthy older adults using hyperbaric oxygen, a randomized controlled clinical trial. So this comes out of Israel. And if you look at this screen, I'm going to keep this simple because this presentation is actually over 100 slides long, and I'm only going to show you 20 of them today. But in this presentation, in this particular slide, they took individuals and they did a functional MRI. A functional MRI means they're looking at how the blood flows in the tissue. They're not necessarily looking at the anatomy per se, like the structure of the brain and is there atrophy. They're looking at blood flow through the brain. This is just three different slides merged together. And you can see the area where there was changes in blood flow throughout the brain. Now, this may be underwhelming to you. You may look at it and say, okay, on this first slide, there's 1, 2, 3, 4, and one back here, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 areas where maybe there was an improvement in blood flow, but they're kind of small areas. Well, guess what? A stroke is kind of in a small area as well. A stroke doesn't engulf your whole brain. It's this little teeny tiny area. And so if these are areas that have been wounded by a stroke or by a head injury, and hyperbaric oxygen can completely change the blood flow to that given area, now maybe it changes all of the dynamics and the dynamic interactions in the brain. Okay, that comes from the same clinical trial. And then one of the authors of that study, named Dr. Shaya Fradi, put this slide up in another editorial. And he said, look, your brain is 100% dependent on blood flow. And hyperbaric has been shown, it's been proven that it increases angiogenesis. Angiogenesis means you'll create new blood vessels to deliver oxygen to certain tissues. So if you look at this brain right here, look at this area right here in the middle of your screen. We want angiogenesis. We want new blood flow. Hyperbaric has proven to improve mitochondrial biogenesis. That means you'll actually make new engines and you'll create an energy improvement. It's been known to improve neurogenesis. So how the nerve cells differentiate and then migrate through the brain and connect and integrate with other dynamic networks of the brain. And it definitely improves oxygenation, and I'll show you some slides. So that's the principle. We would totally be using hyperbaric off-label. We wouldn't be able to get insurance reimbursement for it, but we're using it in the same way it's used for all those indications that may be approved to increase blood flow, neurogenesis, vascular genesis, and so forth. Okay? So hyperbaric oxygen is useful for any condition that may have resulted from a decreased delivery of oxygen at the tissue level. Okay, so think of all of these off-label uses. How about an injury at birth? A child that was born that had a very torturous delivery and was stuck in the birth canal and had poor oxygen flow. How about a TIA or a stroke? Boy, we see that every single day in the world that we live in, the vascular dementias. How about all of our patients that have had head traumas or concussions or TBIs where the brain now has a hypoxic episode because of the inflammation from that injury? How about pediatric neurological conditions like autism, attention deficit disorder? Did you know that there's tons of research where people are taking their autistic kids that have speech deficits at age 3 and they're starting to do hyperbaric chamber, and kids are coming out talking after 20 or 30 treatments? It's mind-blowing what's going on in that research. How about anything that deprives oxygen? So a near drowning or an asphyxiation or severe substance abuse where someone has smoked crack or they smoked pot or methamphetamine and they've got brain damage from these toxic injuries where there's poor blood flow. Multiple sclerosis. I read an article that says in Europe there are 70 locations offering hyperbaric treatment for multiple sclerosis exclusively. This is a treatment in Europe for MS. That's an autoimmune disorder of the brain. That's insane. Neurodegenerative disease like Parkinson's disease and Alzheimer's disease and cancer. Oh, now I'm really getting off on the weeds to say, Randy, you can't treat cancer with oxygen. I don't know. We're not curing it. That's not what I'm suggesting. I'm suggesting any place there's a wound, any place there's been a hypoxic episode, there may be an indication. How about COVID long haulers disease? I still have PTSD personally from a webinar or a telemedicine consult I did with a client in New York City who was a speech language pathologist. And after she got the vaccine, she could no longer talk. That's a hypoxic issue. That's a massive inflammatory response, okay? So let me make this very, very simple. Hyperbaric oxygen means we're treating wounds in any specific location in the body of any duration because we're addressing ischemia from a vascular injury. We're improving hypoxia, right? Ischemia means poor blood flow. Hypoxia means because there's poor blood flow, now we have an oxygen deficit at the tissue level, and those two things combined result in a chronic inflammatory response that just goes on forever. You just can't turn it off. And Eric and I have marveled in Dr. Bredesen's brilliance of saying that neurological disorders are an inflammatory process divided by an energy deficit. And hyperbaric does a lot to help overcome that dynamic. But of course, we work in an environment where people say there's really nothing you can do for dementia because the brain can't regenerate neurons. And then 6 months after a stroke, you are what you are. You're never going to get better. You know, you have those deficits forever. Well, don't read Jill Bolte Taylor's book about her stroke of insight. It took her 8 years and she had a 100% full recovery after her stroke and is now a neuroanatomist at Harvard. You don't just have to learn to live with your deficits. You just have to apply the principles long enough to make a big enough difference. So if I wanted to get super technical and talk about some slides, I picked a couple that to me were so mind-blowingly impressive, changed the way that I viewed hyperbaric. Look at this. Hyperbaric oxygen induces a cytoprotective and angiogenic response, right? Cytoprotective means it's going to protect the cell and all that environment. And angiogenic response means it's going to produce blood vessels to the tissue in a microvascular injury. Now, let me show you what happened here. These people did one hyperbaric treatment of these cells, and they pushed the pressure to 2.4 atmosphere. That's getting technical. I'm not going to talk about pressures today, although I am going to give you one video example. At 100% oxygen for 1 hour. One treatment for 1 hour. And look what happened. It changed the genetics expression of 8,101 genes. Totally changed the way they were expressed. The Human Genome Project says we have about 19,000 and change number of genes in the human body. And a hyperbaric treatment changed and modified the expression of 8,000 of them. So over 50% of, almost 50% of your genetic code was modified by the hyperbaric treatment. 3,280 of the genes that regulate anti-inflammation and repair and regrowth were modified, and 3,968 suppressed inflammatory response and changed the apoptosis process. Okay? That is phenomenal. When I hear people say, I want to do stem cells or I want to do some peptide therapy, I think, okay, cool. You should always do it in conjunction with hyperbaric because you want to change the way the body utilizes those stem cells, suppress the inflammatory response, suppress apoptosis, and increase growth and repair. Okay? So in reality, hyperbaric treatment, which has been around for 300 years, is probably the oldest form of gene therapy that we know of. It has stood the test of time. Okay? And so the top responding genes, look at these genes. Now this is a little technical. I'm not going to get into it, but I've done a lot of research in genetic therapies, and you look at the genes, the FOSB and the FOS gene and all of these genetics that change the way that our body interacts. Sometimes there's as much as a 5-fold increase or decrease. It depends if you're talking about growth promotion or if you're suppressing inflammatory genes, what you get out of that, okay? So it's not only is it the oldest form, it's probably the most extensive form of genetic expression influence that we have in current medicine. And the interesting thing about it is everyone thinks it's just related to oxygen. Actually, pressures make a difference. There was a study in kids that had cerebral palsy. Cerebral palsy comes from birth. We think it's a hypoxic episode that just changes the inflammatory response in the brain. And they put kids in chambers at room air, and all they did was gently increase the pressure, and these kids had improvement. So you have to almost think of hyperbaric treatment as a dual therapy. You're changing pressure and you're changing oxygenation levels. Okay? So if it impacts your genetic, here's a simple and a little melodramatic expression by picture, right? You're suppressing the pro-inflammatory process, and you're changing the way that the cells march on to cell death. And you're increasing the growth and repair promotion, and you're increasing all the anti-inflammatory genetics so that something that looks dead like this can breathe new life in it. Now, that's melodramatic, but trust me, that's what we do with gangrenous wounds where someone has osteonecrosis and osteomyelitis, and we're going to amputate their foot. We put them in a hyperbaric chamber and do 80 treatments, and they grow their foot back. That's going from this side of the tree to this side of the tree because of these reasons. Don't kid yourself into thinking it's just because you put oxygen in that wound. You've actually changed the genetic expression of that wound. So here's how it happens. Look at this slide right here. Right now, everyone on this telephone call is 100% dependent on having a red blood cell to carry oxygen to the tissue. You can't carry it. Your oxygen is bound to a hemoglobin molecule, and as long as you got blood flow to the tissue and then that hemoglobin molecule releases the oxygen, then you can deliver oxygen to the tissue. That's what's showing up here on this side of the screen. But when you put someone in a hyperbaric chamber, you now oxygenate the plasma. So where the red blood cell in this side of the screen is carrying oxygen, when I put them in a pressure chamber, I oxygenate plasma, baby. It's not bound to a red blood cell. It's like a soda pop can. So just think if you open a Sprite bottle. If I open a Sprite, and you see the bubbles start bubbling out of the liquid, those bubbles got there because they pressurized a gas over the top of the liquid. So we put someone in a hyperbaric chamber and they wear a mask. They now start breathing 100% oxygen. And then we pressurize them. We start pushing oxygen directly into the plasma. So what this slide is showing is, let's say they had an injury in this blood vessel, and this blood vessel's crimped down so that blood can't even pass through here. Guess what? Plasma can. Lymph tissue can. And when we hyperoxygenate that lymph tissue, now we've overcome the hypoxic deficit at the tissue level, and that person can restore ATP production, and now they can start restoring all those genetic things that we talked about. So I really like that slide. I thought it was good. So what are the benefits of hyperbaric? There's some short-term benefits, and then there's some long-term benefits. The short-term benefits is under pressure, you increase the oxygen in a chamber, and now we've got all this oxygen available that you can use right now today. I've done some hyperbaric treatment with some patients. One lady that I spoke with on Wednesday said, "Don't tell my husband, but I actually am thinking more clearly." And I said, "Why wouldn't you want me to tell your husband that?" And she said, "Because I don't want my husband to realize how impaired I was before I started this." And I started laughing. I'm like, "Oh, honey, he knows, trust me." Okay? The time frame of that short-term treatment is anywhere between 4 and 12 hours after the treatment. You get this short-term benefit of now oxygen's coming out of the plasma and it's just hyperoxygenating that tissue. And so instantly you'll get a decrease in swelling. You'll hyperoxygenate. You'll change the oxygen gradient level and you'll start off-gassing oxygen in all of these tissues. You'll upregulate your antioxidant response. So we spend a lot of time begging people to take glutathione and N-acetylcysteine and the one that has resveratrol and PQQ and CoQ10. Now we can actually change the genetic expression so they produce more of that themselves. Let their own body do it. But that's not all. Look, there's that can of soda that I talked about, that off-gassing. Once you take them out of pressure, these bubbles, like you see in the seltzer water, start bubbling up out of the tissue. That's what the off-gassing short-term benefit is. The long-term benefit would come long after the treatment's ended. A person does a series of hyperbaric treatments. Let's say they did it for 5 or 6 hours a week for 8 weeks, so multiple treatments a week. Now we start shifting their cellular environment. We're suppressing inflammation and we change their genetic expressions. They're now producing their own stem cells with a greater level of sophistication. And their growth and repair goes up. Their mitochondria get bigger and they hypertrophy and they multiply and divide. And now we're growing new blood vessels and new nerve endings are starting to connect. I mean, you can see where I'm going with this, right? The short and the long-term benefits of that. So all I can say is 4 to 8 weeks post-treatment, boom! You got all those short-term benefits right after the treatment, and then you're actually changing the genetic expression over time. Phenomenal, right? Phenomenal opportunity to heal wounds that have been going on in the brain for 20 or 30 years. So I'm going to start this video, and I'm going to turn off the sound here. And I just want you to watch this video. Hyperbaric oxygen changes DNA expression, permanently changes the cells in the tissue, recruits stem cells, and then you see it has a ricochet effect that just ripples through the entire system. And so I wanted to show this video. I thought of this when I was building this presentation, saying, gosh, this is the benefit that you're going to see, this ripple effect that happens with hyperbaric oxygen therapy. Okay? So just as a fun way of explaining the way gas laws work, how does this happen? I'm going to turn on this video, and I want you to watch this real quick. All they're doing is sucking air out of that chamber. Okay, now you heard what he said. I pushed pause for a second. He said that balloon has the exact same amount of air in it that we did at the beginning. It's not a magic trick. But Henry's law says when you change pressures, gases either expand or they contract. So the reason I was trying to find a really good video to display this. Hyperbaric is going to do what happens to this balloon when he turns off the vacuum. So for example, when he turned on the vacuum, he pulled oxygen out of the container that would be lowering the oxygen pressure and the balloon expanded. Okay, let's finish the video. Now he's increasing the pressure and the balloon shrinks. Okay. So now he's doing experiments. He's putting multiple balloons in. He reduces the pressure and the balloon expands. Now we release. Okay, so my point to this is hyperbaric increases the pressure, and so it would make the balloon smaller. And the cool thing is when you do that over a liquid, the gas bubbles get smaller and then they enter the liquid. That's what's happening with oxygen. I couldn't find a good video specifically about hyperbarics that showed that, so I had to go to a little science experiment showing Henry's law. I hope you understand that principle of how it works. That video is the very reason hyperbaric came about, because divers who get the bends, they go down deep in the water and the pressure is exquisite on their body, and so all the gas bubbles get smaller and smaller and smaller, and they go into their blood vessels. If they come up too quickly, those gas bubbles expand huge and they create air gas embolism and they give people the bends. And I've got lots of slides that talk about that, but I didn't want to start with that in our presentation today. The next video I want to show you is the hyperbaric chamber that will have at a Mind for All Seasons. I've had to go through board certifications and change my malpractice policy so that it covers hyperbaric chambers out of our clinic and so forth. So I've been doing the legwork to make that happen. But this is the chamber that we'll have, and I'm going to turn the audio off because I just want to show you the chamber that we're going to be using and why we're using it. So, okay. So this one's called a biobarica chamber, and you can see it sits on a little table. Very easy to manage the valves. They can be managed from the inside or the outside. Very easy to put the lid on, right? That lid fits on kind of like a garbage can lid, and when the pressure goes on from the inside, the hermetic pressure forces that against a rim, and that's what increases the pressure. It's very simple to transport, very easy to operate and manage. It's considered a soft chamber. It has FDA approval for the treatment up to 1.5 atmospheres, which in all of the research that I've been conducting is the treatment that we would use to address neurological disorders. You can see it has a removable stretcher, so people who aren't as mobile and can't really get into the chamber, we could have some assistance to helping them get inside that chamber and so forth, okay? Very, very little risk, virtually no risk. Very easy to use, very easy to tolerate. The number one risk is we've got to teach people to pop their ears. That's about it, right? So, and I'll talk more about safety and the rhythm about how we do that in upcoming discussions.